Hello, everybody. I am sitting at home and I get a really cool piece of information and I wanted to do this live for my Patreons. I will be posting an edited video with not as much information for the general public of YouTube because I definitely want to make a video, but this video most certainly is for my Patreons. As you can see, I'm still at home. I didn't actually leave to get to the office yet, so I hope you enjoyed this video. So I shared a video the other day about Shyam Sankar, the CEO, Chief Operating Officer. He's like the #2 guy in Palantir. He's definitely like a top 5. He works very closely with Alex Karp, Dr. Karp. And this guy goes on CNBC and he puts out a wild tweet and he's basically talking about healthcare, how, Palantir can help all healthcare, how we're going to take over the healthcare business, how it's a multi-billion-dollar, opportunity, and how the TAM for healthcare is huge. And I make that video and I'm like, listen, this definitely correlates to what he's been saying with the NHS or what we thought is happening with the NHS. So let me jumpstart your memory if you guys don't remember what's happening with the NHS. The NHS is the National Health Service of England. There is a couple of branches. So there's a National Health Service of the UK. England is the largest branch, obviously. They make up the majority of everything. That's like home base. And they wanted to come out with something called a Federated data system, which is essentially you revamping the entire data system of the NHS and bring them into the digital world, bring them into the digital age, so to speak. And this is what's happening right now. So I made that video yesterday, I believe it comes out. And this morning, I'm part of the Palantir Discord, guys. The link to the Palantir Discord is down below. Definitely check them out. You get a lot of great information. And shout out to Ether Squared and a lot of the other people on Twitter, a lot of people on the Discord. I don't want to, be naive and ignorant and take all the credit for this because it's not me. So I wanted to make a Patreon video for my patrons to see if these links work. So they have links. This is not insider trading. This is literally us putting in links to see if these links work or don't work when we sign into the Palantir website. And if these links work, that means that your business or your company or your division or your piece of the government, your department has a unique link when you sign on to the Palantir website. And I'm gonna put in these unique links right now. So there's over 60 different links. We decoded, not me, they decoded like a dozen or more of these links. And I just wanted to verify and show you guys how I put the links in to show you how it all works. The very first thing you're gonna need to do if you wanna try this yourself is turn on your VPN. VPN is a virtual, what the hell does it stand for? A virtual private network. Then set your settings to the UK, United Kingdoms. If you do not do this, it will not work because you have to be, your geographical location has to be in the country that you're actually putting the information into Palantir, which is pretty cool. And it gives them another layer of anonymity. Now I'm gonna share my screen and show you how I go through this. Guys, this is the website for the United Kingdom's Palantir login. If you look up here, right, there's a website. It's necs.palantirfoundry.co.uk/multipass/login/all. When they give you this, they give you like a code name. This actually means something. So NECS stands for North of England Commissioning Support, okay? Let me give you another one right now. This is gonna be, I'm gonna change the NECS. I'm gonna change this to MLCSU. And I'm gonna put that in. And as you can see, it loads, it has its own screen. And what exactly does the MLCSU stand for? It stands for NHS, National Health Service, Midlands and Lancashire Commissioning Support Unit. I'm gonna give you another one right now. The code word is gonna be, and then I'm gonna show you what happens if you put in the wrong code. The next code is gonna be LNWH, and you put it in, boom, and it has its own login. What does LNWH stand for? London Northwestern University Healthcare. I'm gonna do another one right now. LGT. also has a login. Now, LGT stands for one of two things. Again, this is being decoded by people. This is not a 100% fact. This is more like rumors that people are just doing research. This either stands for the LGT Wealth Management or Lusham and Greenwich NHS Trust. There's a bunch of these. Let's try another one. ESHT. 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 You put that in. Boom, it works too. What's ESHT? It stands for the East Sussex Healthcare NHS Trust. There's another one right here. Let's go right here. ELHT. You put that in. Boom, it works as well. What does that stand for? East Lancashire Hospitals NHS Trust. There's more, guys. Let's do the next one. This is going to be COCH. You put it in. Boom, it works as well. What does COCH stand for? It stands for the Counter of Chester Hospital. You want to do another one? Watch this. CHEL. CHEL does not work, but if you put in CHEL West, check this out. 1 second, I just want to show you that not all of these links work, right? You have to actually have the correct one. Watch this, CHEL West. You put that in, and all of a sudden it works. What does that stand for? CHEL, Chelsea West, and Westminster Hospital, right? Guys, so everything that I'm showing you right now, you guys might be like, this is BS, that doesn't work, they're just a bunch of random links. You could say that, and I'm not telling you that these are the links, but remember, I put in like a dozen links. There's a few dozen more that are currently being decoded. I'm not gonna show you the list, it's on Twitter. But there's a list this long of codes that are currently being decoded that you could put into the Palantir Foundry UK website. I showed you that if you don't have an active link, it's not going to work. Out of the 12 that I showed or so right now, it cannot just be a coincidence that all of them, the abbreviations, are something to do with hospitals in the NHS UK system at the same time that we're waiting to get an answer next month of who wins the NHS contract, at the same time that the CEO, Chief Operational Officer of Palantir, actually signs on to Twitter and makes this 10-tweet post. I put it in my last video. And at the same time, he goes on CNBC to talk to CNBC, and he starts going on a tangent about healthcare, how they're remodeling healthcare, how they helped with PPP in America, Canada, and the UK, and how it's a multi-billion-dollar business. Now, originally, it was supposed to be a $240 million contract for the NHS, which I'm going to pull up in a moment. Then they prolonged the contract, and now it's supposed to be a 360 million pound contract. However, a lot of people are saying that this is going to be a 10-year, $1 billion plus total contract for Palantir. Why? Once Palantir is going to revamp your whole medical system. So Palantir is building it up from the ground up. Footing, foundations, walls, roof, and the whole guts, everything. It's rebuilding the entire healthcare system the way it's being analyzed. It's completely digifying the United healthcare system of the United Kingdoms. And when they do that, seldomly will they go anywhere else after Palantir. It's just not going to happen, guys. That's why people are saying that this is possibly a $1 billion plus over 10 years. Let me show you the article real fast. We'll read it together. Guys, this is from the Digital Health, right? This is a website, Digital Health. It says, next update on Federated data platform expected in autumn. I'm going to read it for you, but keep in mind that Palantir went on a shopping spree to hire X high levels of the NHS workers, 2 very high levels from NHS. I'll get into it in just a moment. The NHS England published a notice back in April for a federated data platform, which was described as an essential enabler or to transformation improvements across NHS and will be an ecosystem of technologies and services. An update to the contract notice states that the next update is due September 5th, guys. September 5th, just in 2 weeks. And the update also confirms that the value of the contract has risen from £240 million to £360 million. Pound, guys. Pound. And then it says, the report from the Financial Times suggested that the U.S. software company Palantir was the front runner to win the contract, though this has not been confirmed. And it has not been confirmed. We're confirming it before it happens to try to make an educated assumption in order to invest into something preemptively. I am probably going to add to my Palantir position after this. Now I wanted to show you something. There's another article right here. Second NHS official to join Palantir as it guns for a £360 million contract, guys. Second, not first, second. Harjeet Dilawali, Deputy Director of Data Services at the NHS England and NHS Improvement, will follow Indra Joshi, former NHS ex-Director of AI. This woman right here, Indra Joshi, did the largest spend in NHS history, and her department was literally artificial intelligence of the NHS. That was literally what her position was. And I quote, "We are delighted that Harjeet is joining Palantir's UK team, which we are aiming to grow by 250 people this year." If you didn't know, Palantir wants to have 600 people that are working in the United Kingdoms. They started with 250. I think they hired like 150. And this would be another 250 to get them to 600. Guys, Palantir is a beast. It takes time to get the contracts. Like I said, let me just align all of the stars for you. We learned about this contract in April. We know Palantir has worked with the NHS already. Civilians wanted to audit the NHS, and the NHS said, F you, you're not giving us an audit. We're going to do what we need to do. Palantir has hired 2 high-level officials from the NHS. The CEO, Shyam Shankar of Palantir, all of a sudden goes on CNBC and all of a sudden makes a 10-tweet link on Twitter. Guys, he has less Twitter followers than me, like 4,000. Why would he go on Twitter? Why? Twitter, CNBC, hiring 2 high-level officials, and all of a sudden, in a background with NHS, and all of a sudden, there's all of these links that I showed you. If the links don't make sense, it does not work. You cannot sign into that Palantir website. So I can't get into their actual link, but it shows that they actually have a link and you got to put in the password. I obviously don't have the password and I'm obviously not trying to hack anything, but it shows you that there is a link. So this can be one of 3 answers. The first answer is, this is an extreme coincidence that we found 12 plus links out of a total 60 that we're still decoding that actually have the acronyms, like the letters actually mean something, or abbreviation, I don't know the word that I'm using, that they actually mean something when you sign in. 2, all those abbreviations is because they're doing testing for the NHS and maybe they're just trying to get the contract, but they don't have the contract yet. That is a possibility. Or 3, all of the links that I just put on are valid links. They just went online because in around 2 or 3 weeks, there will be an announcement that Palantir has won the £360 million Federated Data Revamping System for the United Kingdom's NHS program, National Health Services of England. If Palantir gets this, they're one step closer to my thesis and hypothesis of major growth. Now, if they could revamp an entire country's healthcare system, think about it. Which healthcare system is next? Which healthcare system, think about it, is influenced by the UK health system? One health system is Canada, right? The Canadian healthcare system. It's also healthcare for everybody, if I'm not mistaken. And there's a lot of other countries that do national healthcare. So if Palantir can actually free up bed spaces, free up personnel, make sure that the waiting times are less, make sure to allocate supply chains where they're needed, because that's what Palantir is doing. That's the problem. With a federated system, nobody cares. Nobody's giving you the excellent care. So how do you increase care? How do you increase capabilities? How do you increase efficiency? Well, you decrease inefficiencies in real-time data. So Palantir is going to take all of these different departments and sub-departments of sub-departments in different cities and counties that they have in England. I don't know how it works with you guys. Maybe, I don't know, think you guys have states, right? You guys have counties. So it's going to take all of these provinces, counties, whatever, local jurisdictions, local departments, sub-departments, and they're just going to coordinate everything to make sure that they're as efficient as possible. It's going to be like one huge beehive where everybody, like worker ants, right? Everybody in the collective is doing their own thing and doing what they actually have to do. That's the difference of what Palantir is going to do and what a project like Snowflake does. Snowflake can help your local hospital, like, right? If you would compare Snowflake to Palantir, Palantir is literally revamping the entire NHS, National Health Services of England. Everything, every department, every sub-department, every city, state, jurisdiction, right? Everything. While Snowflake would be able to do that for one specific hospital or one specific county, but they wouldn't be able to coordinate everything through digital twins and real-time information like Palantir. And that's the difference between Snowflake, C3 AI, Datadog, Datashet, whatever, and Palantir. But it takes time to get these Palantir contracts. Now, I could be completely wrong. I'm not a financial advisor. I'm not a mind reader. I'm not an investigator. I'm none of that. I'm just a guy on YouTube that gets some leads, and I'm sharing this with my Patreon community first, and then I'm posting this video on YouTube. And if you guys appreciate this type of dedication, give me the like, share, and subscribe down below. And if you want to join my Patreon, feel free. I have a link down below. I would appreciate any support. We have a private group. We have private lives. I have a public portfolio for them. And I give them videos like this. This was a hard video to do. I could have made an easier video where I don't need to put in the links and talk about some nonsense. But I do it for my guys. I do it for my community. So thank you so much, guys. Give me the like, shares, and subscribe. And I'm going to go answer some questions from my Patreons in the audience right now. Have a great day. Yo, Hippo, what's up, buddy? I'm done with the video. So if you guys have any questions, let me know. But let me know if what I just said makes sense.